Welcome back, future orthodontists. Today we discuss anterior open bite, a challenging malocclusion in both children and adults. Anterior open bite occurs when the upper and lower anterior teeth do not overlap vertically when the posterior teeth are in occlusion. Remember the mnemonic? NOV, no overlap vertical. Causes include habits like thumb sucking and tongue thrusting, skeletal growth patterns such as long face, posterior dental extrusion, genetics, and temporal mandibular joint disorders. Use the mnemonic HSPGT, habits, skeletal, posterior extrusion, genetics, TMJ. Identifying the cause is crucial for effective management. Clinical features include lack of vertical overlap of upper and lower incisors, lip incompetence, speech difficulties, and aesthetic concerns. The mnemonic is OLSA, open bite, lip incompetence, speech, aesthetics. Management depends on age, severity, and etiology. Habit interception involves stopping thumb sucking or tongue thrusting early. Orthodontic appliances like braces, bite blocks, or functional appliances help correct the bite. Surgery may be needed for severe skeletal open bites in adults. The mnemonic is HOS, habit, orthodontics, surgery. Early intervention improves function and aesthetics. To summarize, anterior open bite essentials are definition, NOV, no overlap vertical, etiology, HSPGT, habits, skeletal, posterior extrusion, genetics, TMJ. Clinical features, OLSA, open bite, lip incompetence, speech, aesthetics. Management, HOS, habit, orthodontics, surgery. Quiz time. Question 1. What does NOV stand for? Question 2. Which is a common cause of anterior open bite? Question 3. Clinical features mnemonic? Question 4. Management mnemonic. Excellent! You now understand anterior open bite, its causes, features, and management. Next video, Reverse Overjet, Class 3.